Hi, welcome to our sixth Fall Prevention Month lunchtime talk. On Friday, we had Patrick Antonio speak to us about diabetes and fall risk. So I'm not sure if you know, but a lot of people with diabetes tend to have peripheral neuropathy, which is a loss of sensation in their extremities, including their feet, which can lead to impaired balance control. So if you have diabetes, it's a good thing to check for. Today, we have Dr. Kristen Messelman joining us. She is a scientist at Lyndhurst, one of our other Toronto rehab sites. She does a lot of work on spinal cord injury, and she's trying to find out what are some reasons that people with spinal cord injury are at increased risk for falls, and what are some things we can do to help reduce that risk. So she's going to tell us a little bit more about her work. Oh, thank you.
Thanks, Christiane. So I'm very happy to be here and talk to you about spinal cord injury and the risk of falling after someone's had a spinal cord injury. So this is a group that I've worked with for about a decade now, both as a scientist but also as a clinician. So my background is in physical therapy. And just to start off, I'm going to just briefly mention what a spinal cord injury is. So this is an injury that happens to our spinal cord, or the nerves that leave our cord at the bottom of our spine. And what this causes is paralysis, so inability to use the muscles to move, reduced sensation, and also changes in other body functions. So for example, bowel, bladder, and sexual function may be affected as well. And how much damage or paralysis a person with spinal cord injury experiences really depends on where in their spinal cord the damage occurred. So in this diagram here, if the damage happened up in the neck or in the cervical cord, if you see the person here with the red shaded area, that's the area of the body that could be affected. If it's further down in the cord, so more in the thoracic spine, so mid to low back, it's going to be more just the legs, so the arms will be spared. And then again, if you move further down, the less or the smaller amount of the body that's affected by the injury. Now, when somebody sustains a spinal cord injury, there's two main types. One is called a complete injury, and one is called an incomplete injury. If you have an incomplete spinal cord injury, that means at the level where your damage has occurred, not the entire cord is damaged. So there is some spared function. So people with incomplete injuries, which accounts in Canada for about 70% of our population with spinal cord injury, they will still have maybe some movement below the level of injury, some preserved sensory function as well. And that tends to be the group, because my focus is often on walking in my research and as a physiotherapist, I tend to work mostly with people that have incomplete injuries. So falling after spinal cord injury is not, surprisingly, is not something that we hear a lot about. After spinal cord injury, there's many priorities for the rehab: regaining bowel and bladder, cardiovascular health, mobility, sexual function. All of these things are important. And falls is one thing that I feel is not being targeted enough yet, and hopefully through doing some of these talks, I hope to increase awareness about falls after spinal cord injury, because it actually is a very common problem for people that have a spinal cord injury, especially those with incomplete injuries. So who tend to be the ones, like most people with incomplete injuries will regain some walking function, and they're at high risk of falling. So 75% of those individuals will fall in a given year. A lot of these falls happen while walking. So walking is the risky behavior that leads to falls. Just in comparison, for those who don't walk, they still fall quite a bit. So their fall rate is around 31%, so typically falling out of their wheelchair. And falls has many negative consequences. So obviously injury. So it's common to get cuts, bruises, abrasions, but fractures are not uncommon in people with spinal cord injury. So upwards of 18% of falls can lead to a fracture. That can also lead to readmission to the hospital, which it's costly for our healthcare system. And then importantly, it can elicit a fear of falling in people with spinal cord injury. And although it hasn't been studied much, although we're looking at it, but in the spinal cord population, fear of falling is very prevalent and well studied in other populations, such as older adults and stroke. And we know that fear of falling can lead to restriction of activities, and ultimately that can impact quality of life. So why do people with spinal cord injury fall? Unfortunately, we right now don't know very much about the underlying causes. There's a group actually from Thailand that's done some really great work trying to start probing these questions. And they've come up with, environmental hazards and loss of balance are important factors, which I think is true. But I want to probe a bit deeper what environmental hazards and what actually causes the loss of balance. So I think there's still a lot we need to learn about why people with spinal cord injury fall. And then a few months ago, there's this really interesting study from the US. It's a large study. It looked not just at individuals with spinal cord injury, but also other conditions as well, like multiple sclerosis, I believe Parkinson's disease as well. And they looked at specific risk factors for these different conditions. And one thing that was very interesting about the spinal cord population is they were the only group that had physical activity as a risk factor. So if you have a spinal cord injury, the more physical activity you engage in, the more likely you are to fall. Okay? And so this is, I think, a really important point, because we've put a lot of effort into research and also clinical initiatives for spinal cord injury to try and increase physical activity, because that helps to keep people healthy. But I think what we're realizing now, it also places them at greater risk of falling. So one of the goals of my lab is to have a deeper, richer understanding of why people with spinal cord injury fall. And from that, determine how we can help prevent falls in this population. And specifically right now, our focus is understanding from their perspective, so asking people with spinal cord injury themselves why they fall. So I just want to mention one study that we've done to try and answer this question, and this is the initial phase of this study. But we used a qualitative research methodology called PhotoVoice. And what PhotoVoice is it's a participatory research method where individuals that you are hoping to study essentially become researchers with you and help you collect information about your topic of interest. So in our case, we wanted to learn, why do they fall? What places them at risk of falling? And so we had a group so far of 8 individuals with spinal cord injury do a photo assignment. So we give them a camera if they need a camera for a week, and we give them this photo assignment. And they're asked to take pictures of to reflect different questions. So for example, what increases your likelihood of falling? What decreases your likelihood of falling? And how does the risk of falling affect your mobility and physical activity? So they, over about a week, take some pictures, they come back in, and then we use the pictures as the basis for a discussion and try to learn from their perspective why they think they're at risk of falling and what places them at risk. So I just want to share a couple of the photos. We've gotten some great photos from our participants, and I'll just sort of mention what they were thinking when they took the picture. This woman took this picture reflecting the footwear she'd like to wear, and then the footwear that she has to wear now as a result of the risk of falling. Sorry, I have these going too quickly. The escalator was a picture taken just to reflect that public transit and being in public places with a lot of people, having to negotiate stairs and escalators is very tricky. And then the final picture was a picture of, if I can go back, some bicycles. And that picture was taken from a woman who actually walks quite well after her spinal cord injury, but is too afraid to try and get back onto her bicycle, which is something she used to do a lot before her injury. And this is something that she's just too afraid to try doing because she feels she'll lose her balance. So through this process, we've gotten some insight as to what things in the environment put people with spinal cord injury at risk of falling. But I think almost more importantly, what's come out is from these 8 individuals, we've learned what strategies they use to try and reduce their risk of falling. And I think this sort of information is what we can base future fall prevention education programs for this population on. So just to give you an example, they all talked about pre-planning their outings. So it's not enough just to phone up a restaurant and say, are you accessible for a wheelchair? Because what people have found is they're usually going to tell you yes, but then when you get there, it's actually not accessible. So having to actually go to a location in advance of, the dinner out that you have planned and check whether or not it's accessible. Scanning the environment. This is one thing that our whole group seemed to do as well. So really when they get out in the community, stopping and actually looking around, being aware of what hazards are there, and then having to plan their route based on what they see. So something that we typically don't do that as able-bodied individuals. I'll just give you a quote. Awareness, I think, is one of the key words that I use a lot now. So scanning and being aware of your surroundings. They talk about having to go very slowly. So for example, sometimes one woman was saying she might let 3 or 4 buses pass before she gets onto the bus to go where she needs to go, just depending on how many people are on that bus and how crowded it is and how much she thinks whether she can manage that and keep her balance. Concentrating all the time on their mobility and where they're going and the hazards that are in their environment. So for example, one gentleman said, Whenever a fall happens to me, it's because I'm distracted and not paying attention, or, you know, I'm overconfident in where I am in my environment. So anytime that they let go of that concentration, that's when the fall seems to happen. And then lastly is this idea of learning about falls and how to prevent falls through experience. So some talked about, first of all, you have to fall to learn not to fall, which I thought was really interesting, because I know one thing that we try to do as physical therapists is when they're with us in rehab is we don't want them to fall. But maybe there's a way we should be practicing falls in a controlled, safe setting. So for example, one gentleman said, so falling out of the chair helps you learn how not to fall out of the chair. But in order to learn how not to fall out of the chair, you have to fall. Kind of like a little vicious circle going on. So learning not to fall through experience, but also through peer mentoring. So people mentioned that they did find having a healthcare professional tell them about falls, they acknowledged it, but it was really their peers, when the peers told them what to watch out for, that seemed to resonate a bit more with them. So those are some strategies that as we move forward, I hope we can implement into fall prevention programs for people with spinal cord injury. And then the other thing I want to talk about is how is their walking balance actually affected? So we've learned a lot about in the environment, how it places somebody with a spinal cord injury at risk from our Photo Voice study, but also how does their balance ability affect their risk of falling? And so there's two types of balance reactions that we've been studying. One's called proactive and the other's called reactive. So the best way to explain this is to give you an example. It's wintertime and it's icy. You walk outside, you see a patch of ice. And so when we see a patch of ice, we usually change how we walk, right? We modify our steps in order to be able to walk across that ice without losing our balance. That's a proactive strategy. We anticipate the threat to our balance and we change our behavior. In contrast, let's say you didn't notice the patch of ice and you walk to it and you slip on it, but then you recover your balance, as most of us probably would. That's a reactive strategy. Okay, no pre-planning, but our body, our nervous system knows how to react to the threat. In spinal cord injury, we know very little about walking balance deficits. So how does their proactive and reactive balance, how is it affected by their spinal cord injury? And really, we need to know this information in order to learn more about how we can best target balance training and rehab. So another aim of our lab is to try and identify the balance deficits that are specific to people with spinal cord injury. And I just wanted to mention some of the ways that we're doing this. So I'm going to play this video. So this is actually a laboratory in Saskatchewan where I still do quite a bit of research. And in this laboratory, we have people with spinal cord injury. This is Janelle. She's a grad student just demonstrating. But we have them walk with, they can have body weight support. That's the harness holding them up, but it also keeps them safe while they're walking. We have little sensors that record their muscle activity, look at the movement of their joints as well. And we have them do challenging tasks like walking heel to toe. We also have in the floor, we can insert a controlled slippery surface, so we can actually elicit some reactive balance strategies when they're not expecting it. And we've been studying, so far we've studied about 22 people with incomplete spinal cord injury walking in these different conditions. And what we've found is that we're studying people who've had their injury for at least a year. And in those people, they show greater proactive balance compared with age and gender matched able-bodied adults during walking, which kind of surprised me at first. But in retrospect, I think it makes sense. Over time, I think they've learned how to try and compensate and keep themselves as safe as possible. But interesting, even with those enhanced proactive strategies, they still fall quite a bit or have near falls in the lab. And so what we think is happening, there are reactive reactions that are impaired. We're not advancing. We're stuck. I think I know what the next slide is, so I'll just keep talking. The other thing that we're doing is we're looking at more clinic-friendly ways to measure walking balance after spinal cord injury. So we have some sensors. They're basically accelerometers, and they get worn. It just looks like a wristwatch. And they're worn at the wrists, at the feet, the trunk, and the chest. And we've been looking at whether these sensors can pick up people at risk of falling. We are finding some interesting things that even in high functioning people with spinal cord injury who do quite a bit of walking but still fall, we are noticing some very subtle differences in their trunk movement while they're walking, and also some other parameters that usually are reflective of stability. So that's the other piece that we're doing, is using these sensors and hoping that eventually it can be used to identify those who are at risk of falling and may require more rehab interventions. So there's a picture actually of just one of the sensors. I'm going to go to view, I think. Thanks, Doc. So just to summarize, we'll get that. Oh, sorry, slideshow, yeah. Perfect. So just to summarize, I think there's 3 main points I was hoping to make with today's talk, is that falls are prevalent among people with spinal cord injury, especially those who are physically active and who are walking. So in some senses, it might actually be the ones who are less affected by their spinal cord injury that are actually at greater risk of falling. People with spinal cord injury learn typically through experience, strategies for compensating for their poor balance. And some of these strategies that we are starting to learn about, we hope to implement into education programs for fall prevention. And then lastly, that we think it's reactive balance reactions that need to be targeted in people with spinal cord injury, and that their proactive balance is actually, they learn to develop that over time. So some future directions: develop effective methods of retraining reactive balance in people with spinal cord injury. And I'll just put a plug in for Avril's talk, I think that's coming up later this month, and she's going to talk about some of the work they've done retraining reactive balance in stroke. And so Avril and I are working together to try and move this forward in spinal cord injury. We hope to find ways to effectively assess fall risk. So again, maybe the sensors is one potential avenue we're pursuing. And then lastly, develop education on fall prevention and possibly a peer mentoring program for people with spinal cord injury. And so just to acknowledge, we've had many dedicated individuals with spinal cord injury participate in this research and have been very engaged, which has been fantastic. A number of different collaborators on these projects. 2 graduate students that have been focused on that work, and also our funding body. Okay.
Thank you very much, Kristen. I was wondering if anyone from the public has some questions. Any questions? No? Okay. Well, it looks like you addressed everything. Thank you so much for your talk. It was really interesting to hear that falls can be such a big problem among people with spinal cord injury, something I didn't realize. So thank you for that. Please stay. We have a tour of our IDAPT facilities happening right after this. The next one is booked on Thursday, if you can make it today. And come back tomorrow. Tilak is going to be talking to us about how staying active is just as important as preventing falls. So thank you for this, and have a great afternoon. Bye.